Welcome back to the Urology Care Podcast. Very special guest with me today. I have with me Mr. Jay Baylor. Mr. Jay Baylor is a public member of the Urology Care Foundation Board of Directors. How you doing? Welcome to the program.
Thank you so much, Casey. It's a pleasure to finally be here.
Yeah, we've been trying to set this interview for quite some time. You have a pretty interesting story as a patient, and we want to hit on that. Before we talk about your journey, tell me a little bit about your background.
Sure. I'm originally a New Yorker, live in Florida now, 2 grown daughters and 4 grandchildren. Predominant part of my career was spent in the office products industry. I moved around a little with that and lived in Boston for my last 15 active years before becoming what I call retired. I actually have worked out the tired piece, but not the re-piece. I'm still working on it. I serve on 4 boards as a board of directors in addition to the Urology Care Foundation. I'm an operating partner for a private equity group, so this is my version of retirement, just enough to keep my brain from turning to garbage.
Man of a million priorities, I would call him. But I want to hear about your experience with prostate cancer.
Sure.
How did you find out?
Every male in my family, my brother, my father, I, all had BPH. And as many of you are listening realize, that requires your PSA to be monitored fairly aggressively from an early time because BPH can mimic PSA changes and it's hard to discern what's really going on. So I had for years, when my PSA would go a little bit higher than we would like, I would have to go through biopsies, that fun experience that many of you know about. And consequently, after about 7 or 8 years of it being monitored, and I wasn't surprised, I got the call from my urologist saying, that I had presented with malignant prostate cancer. I really wasn't surprised. I really wasn't shocked. I really didn't go into a tailspin. And my journey actually began then with my displeasure with not getting everything that I needed to know as easily as I wanted to, and with getting some misinformation along the way as well. And more importantly, it leads to my whole mission, which, as I think I've articulated to you before, Casey, men don't talk. You just don't get a group of men sitting around talking about these issues. And I think there's something fundamentally wrong with that. I think that women have brought breast cancer, for example, out of the closet because they've been willing to talk about their emotions, their scars, the intimacy issues with each other as well as with the greater world. And men don't talk. Men just don't talk. I think there's some ego involvement with the concept of, oh, my penis doesn't work, which has led to my hashtag, which is hashtag more than a penis. I just believe that penis doesn't define who I am. I am not confident or influential, if I have any influence, or involved in things because of my genitalia. That did not change after I had ED issues. That didn't define who I am and doesn't define who I am. And I think that's one of my biggest issues with the entire process and the entire procedure. Was getting my hands around that, finding people who wanted to help me deal with it. When I found out, I reached out to acquaintances, friends in the urological field, and was pretty much universally given the same course of action, that I needed a radical prostatectomy. The way I presented, I was not a candidate for seed implantation or any of the other protocols. And then the only question became robotic, Da Vinci assisted robotic, or traditional. And that's where my dilemma began with getting less than truthful information from medical professionals that I was dealing with.
I just want to mention, you might hear some background noises. We are recording this in Midtown Manhattan right now, so you may hear a siren or a horn honking. To me, I'm a city guy. These are just ambient noises to me. But I did want to mention that in case anyone was wondering about that.
Yeah, we are not about to be arrested. It's just a sixth floor apartment facing
Yes.
3rd Avenue.
Exactly. So you did have the family history of BPH.
Correct.
Were you caught off guard at all by your diagnosis?
I wasn't. I was very calm, and I think One of the reasons I was so calm was the consistency of the advice I got from my support team. I didn't have people I know who end up confused. It's because different medical professionals are giving them different courses of treatment. And in my case, nobody disagreed with the course of treatment. It was just how to administer that treatment. And I just have to tell you a great story. I was at a major medical institution as I was vetting where to get it done and how to get it done. And we were discussing their Da Vinci program. And I met with their team and they said, yes, we can do it. And I said, what do your numbers look like? And they said, well, our better trained doctors, the numbers are pretty much the same as traditional surgery. I said, okay, so are you going to give me a list of your doctors by which ones have the most training and which ones don't? Oh no, it's the luck of the draw. So I immediately said, bye-bye, this is not the place for me. I thought that was a bizarre response from highly professional medical professionals. And then it just became a question of the traditional radical surgery or Da Vinci at a different hospital. The numbers were really kind of similar. Ostensibly, we were told they were similar. And the difference was recuperation period. You're out of the hospital in a day or two after Da Vinci. Mm-hmm. It takes a little bit longer with the traditional surgery. Mm-hmm. So I went for Da Vinci.
Do you have advice for men on early detection? What are your thoughts on that?
Look, to not get screened is absolutely foolhardy. You're talking about a blood test. And if the blood test shows you need further workup, so you get a biopsy. I mean, in this day and age, I think everybody understands, for example, that preparing for a colonoscopy may not be the most fun thing in the world. But you don't have to worry about dying from colon cancer if you have regular screenings, regular colonoscopies with your doctor's guidance. I think it's the same thing as far as I'm concerned with prostate cancer. I'm 9 years post-surgery. I have a wonderful life. And I think avoiding the realities of life is like an ostrich sticking its head in the sand and thinking nobody can see it. Yeah. Cancer can still see you, regardless if your head's in the sand. Totally. So I think it's foolhardy, immature, and irrational not to get regularly screened. The difference between, I'm 72. The difference between us and our parents' generation, or your grandparents' generation, probably when they were 72, or great-grandparents, is that we take better care of ourselves. We have more vital lives at this stage. When I think about my dad, may he rest in peace. First of all, he passed at 72. But second of all, he was an old man by the time he was 60 because he had to give so much of his energy and his vitality to keeping a roof over his 4 children's heads. We worked hard, but we had more balance in our life. Not complete balance in our lives, but we had more balance in our lives. And I think we're going to live longer as a result of it. I mean, I do stuff athletically that my father would never have dreamed of doing at this stage of his life.
You mentioned driving a race car. Do you want to tell us about that?
Sure. When I was 45, I've always been a car freak. And when I was 45, my wife bought me a birthday present thinking that it would get it out of my system. Yeah. She sent me to race car driver's school for a week in Lime Rock, Connecticut. It kind of backfired, and I only wanted to do it more, not less.
Did you see Paul Newman during those times? I know he was big into it.
He was, as was, when I was there, Michael Andretti, Mario's son, was there doing the course when I was there. But yes, I saw him warming up at Lime Rock, and let me tell you something, he was serious. He was not an amateur. He was serious, Paul Newman, and he could have been a superstar car racer if he had chosen to do that. He was not a dilettante in any way. I'm a dilettante. He was not a dilettante.
Well, the point is you're a very active guy. Clearly the career had its own demands, family life as well. Tell me about how the prostate cancer diagnosis and how did that impact your life? Were you able to still get your responsibilities taken care of? How did it impact your day-to-day?
As I recall, I was home for about a week or 10 days after, but I had to do an investors conference call for the public firm I worked for one day post-surgery. And I have no idea what I said, but they all liked it. I can't remember a word because I had been under anesthetics the day before and I was a little bit spaced out. The predominant issue with the recuperation is that you're catheterized. Mm-hmm. You get used to that after a while, but it was not particularly awfully painful or there were no other complications. And I was back in the office within 10 days with a portable catheter strapped to my thigh and feeling good. I didn't feel terrible. I didn't feel diminished. I was fine.
Yeah.
Everybody knew I was going for prostate cancer surgery.
Yeah.
I always felt there's something about being human and vulnerable that I think is a good thing to be, not a bad thing to be.
Yeah.
I think being open with people.
So everyone knew, your coworkers.
Everybody. I had 12 direct reports. I had 10,000 employees, but I had 12 direct reports, and they all knew that I was going to the hospital for prostate cancer surgery. Many of them, we may not get into this, but a week ago Monday, I went in for implant surgery because of growing ED problems. And many of those people who worked for me are well aware of what I had done a week ago Monday.
And every listener to this podcast as well. And we thank you for your transparency and your willingness to be so candid and talk about these issues that a lot of men who may be listening are not as comfortable discussing.
So let me tell you, men who are listening, some of the things doctors may not tell you. That leads to, and doctors are wonderful people. Do not come away from listening, if you choose to listen to this, with a feeling that I'm trashing doctors. They really do amazing work and save all of our lives. But the concept of good as new, which you will hear from many doctors over your lifetime, is just baloney. You're never as good as new. You're better than you would be without their intervention. And you're better than most other scenarios, but you're never good as new. You're always slightly different and slightly diminished from where you were before. I was told I would be as good as new after my prostate cancer. I was told by every specialist I talked to before the surgery that their numbers were outstanding in terms of preserving function. That the two main issues were incontinence, which I never had, and ED, but the numbers were outstanding at preserving function. After the surgery, when I was having difficulties, every medical professional said, well, we do deal with an older population and there were other issues in terms of blood pressure issues of this kind of a population. So it's hard to determine what's a result of the surgery and what's just a result of the age and demographic of our clients. I think there's something disingenuous about not being willing to discuss that in advance in an open and honest fashion. I don't know if medical professionals think maybe you wouldn't have it done if you knew that. But once again, penis doesn't define who I am.
Do you have advice for men who don't speak up and who might just be a little shy? Is there anything you would say to them?
Yeah, I think that all of you need to ask every question of your medical team. And if you don't like answers, search for them. Come to places like the Urology Care Foundation. Go search out they're there. Don't be shy and hesitant. Don't let people tell you what they think you want to hear. Find out the truth. The truth will really help you get to it. It sets your expectations. And it makes things easier in the long run because there's no surprises when you know what to expect.
Yeah, we had talked before this interview over the phone, and you had expressed to me the importance of men being their own advocate. Is there anything else you want to expand on?
Yeah, it's, I as I said, I'm 72, and I grew up in an era where doctors were God, and you didn't question them. They were supreme, and you only said thank you. But what's changed since then is in all cases, in all instances, we need to become our own advocates, not just men who are suffering prostate cancer, but all of us need to self-advocate. All of us need, as I told the story before about the one robotic center that gave me a stupid answer. If I didn't ask that question, I may have been there and I may have gotten the worst ranked surgeon, not the best ranked surgeon. So you need to ask every question and not be ashamed, embarrassed, or worried about insulting anybody. It's your life. It's your well-being. It's your continued well-being on a going forward basis. And you can't depend on a friend, a cousin, a brother-in-law, because no two cases are the same. You must own it. You must own getting the data. You must own digesting the data. And you must own evaluating the data.
You mentioned the recent surgery you had. We're recording this less than 2 weeks, about 10 days.
10 days.
10 days. Do you want to tell us about that?
Sure. I was left with ED after my procedure 9 years ago, and tried all kinds of alternatives. The longest lasting alternative was injections. Don't want to gross anybody out. But it's not the most fun thing in the world. And in addition to that, the formulations have to constantly be changed and upped and tweaked, and it doesn't work all the time. And from my perspective, there was a loss of intimacy and spontaneity. That's the word, a loss of spontaneity, because you inject and then you wait for 10 or 15 minutes. And that by that time, I could go in the bedroom and my wife could have changed her mind. She's not here. I'm very brave when she's not here. So there's no spontaneity. And we both had a problem with that. And sometimes it didn't work. And you've gone through all that of injecting yourself and it didn't work. So after it working less and less, I decided it was time to start investigating implants, and made that decision actually about a year ago. But through various reasons, it got postponed in September of 2018. And then through a weird set of circumstances, it got postponed on April 30th and rescheduled for May 13th. But it came off May 13th without a hitch.
And this was not a medically necessary surgery. It was just considered.
It's elective.
It's elective.
Yes, it's elective.
Okay.
And it is what it was positioned to be. That it would be uncomfortable for several weeks, and it was uncomfortable for several weeks for 10 days now. I did make the regular rookie's mistake. Day 2 post-surgery, I walked to the corner and back in New York. Day 3 post-surgery, I walked around the city block and felt great. Day 5 post-surgery, because I did so well with the first 2 outings, I walked a mile in the morning and came back and was in agony for the next 24 hours. So I learned my lesson quickly that this is a pretty big surgery, and you need your body to rest and recuperate slowly and surely. And it is, and I'm doing much better. It's now more discomfort than pain.
Yeah.
And I'm allergic to all pain meds, so I've done this with no pain medication. And I don't feel badly about that. I don't remember thinking, oh my God, I would do anything for a pain pill. It was painful, and I never thought I would enjoy an ice pack to my scrotum as much as I have, but that was one of the best smiles I had over the last 10 days. I'm very pleased. My wife was really adamant that I know that I was not doing this for her, was her line. And I said, I'm doing this for us, not for you. We're too young for that intimacy to be gone. I'm not willing for it to be gone, and we're doing it for us. And I probably wouldn't have done it. I've been married for 45 years to a wonderful woman. And I would not be who or what I am without her. and her support going through this has been the perfect ingredient, as well as my friends. As you can tell from this podcast, I'm kind of open, and all my friends know what I'm going through.
45 years of marriage. That's it's inspiration for me.
Are you married?
Not yet,
Okay.
not yet, but it's looking good. The signs, the future looks like it's heading in that direction. So, absolutely. Well, back to kind of along the lines of marriage and family. Tell me about your support system. Your kids were grown at this point. How old were your kids? How did they take it?
I have a 41-year-old daughter and a 38-year-old daughter.
Mm-hmm.
They've both been very supportive. They both know, as well as their husbands, what's going on. One of them gets a little skeeved out by the details and just wants to know I'm okay or I'm not okay.
Natural for a daughter to have that.
And the other one seems more involved generally.
Okay.
But they're both wonderful kids and both wonderful parents and wonderful wives and my daughter came over here to have lunch with me today before you arrived. My New York daughter. Good. And
was it tough telling them? Like, did you hide it for a bit or
no?
Okay. Just open and honest.
I this concept of why would I hide it?
Yeah.
Why? If you get to the point where you accept that your essence, your vitality, your nature has nothing to do with ED or not ED, what is the downside? Why wouldn't you tell people that you're going to get it done?
I know I've talked on this podcast with other prostate cancer survivors, and one patient in particular told me it was hard for him to tell his daughter or daughters when he had prostate cancer because they looked at him like he was invincible, like he was Superman, like he had always been.
Still is.
Yeah, still is.
He still is.
Okay.
That's exactly my point.
Yeah.
He still is. Whatever they thought he was before prostate cancer, he is no different after. That's exactly the essence of my mantra. Yeah. I am no different because of this than I was pre this. I am not less of a father, less of a husband, less of a force in the people whose lives I interact with than I was before. Yeah. So if this doesn't diminish me, why hide it from people?
That's a really healthy outlook, I think. And I'm curious where that comes from. Have you always been that way? Is this something you developed in the Army or something in childhood? Like, how did you formulate such a healthy mindset for these obstacles?
So this may never make it into the final cut, but there's a psychological syndrome called Imposter Syndrome. And there have been some books written on it. Imposter Syndrome is you convince yourself that you have fooled the people around you with who and what you are. And the next challenge that hits you tomorrow is the one where you're going to be shown to be a charlatan.
Or an imposter.
And an imposter.
Yeah.
It's very debilitating, strikes a lot of type A's, because you come home every day and look in the mirror and say to yourself, thank God I fooled them for another day. You never relax or honor or respect yourself. And I suffered with that for many, many years. And I finally decided to think about it. I had to think about it a lot. And I started looking in the mirror and seeing myself as others saw me and seeing that I was not a bad person. I didn't steal. I didn't cheat. I didn't take advantage of people. And that I was a pretty good person. And I started to believe that I was a pretty good person. And that became the most liberating, freeing part of setting me free from shackles that had held me back. This is going to sound bizarre to you, but I used to, if a door was closed, I convinced myself it's locked. Don't bother trying to open it. And there's a song by a songwriter of when I was young named Cat Stevens, who you may or may not know.
I know Cat Stevens.
And there was a song he did called Sitting. And one of the lines that is probably my favorite line from any song in history: life is like a maze of doors, and they all open from the side you're on. And that kind of just exploded it for me. I had the power to open any one of those doors if I chose to, or not to if I didn't choose to. And kind of freed me and set me free to discuss who I am and who I'm not, and to accept who I am and who I'm not. Always striving to be better, to be more, but grateful for who I am.
What you just said would explain kind of that healthy mindset that you carry to today, in my opinion.
I have to tell you a great funny story, though, about I was just to refresh my memory about disappointments. The day they took my catheterization out after my prostate surgery, my radical prostatectomy, I was in the doctor's office, in the surgeon's office, and I had to go to the men's room. And I went out to the men's room for the first time without a catheter and stood at the urinal. And first of all, not to be rude, but your stream is about 100 times stronger than it was prior. But the second issue is, as you're standing at a urinal, sorry, I don't mean to gross people out, because you've had a portable catheter in strapped, in my case, to my right leg, you're now peeing on your right shoe. I went back into the office and said, "Doc, I peed all over my right shoe." He says, "Oh, I forgot to tell you about that.
Yeah.
That takes about a week or so to straighten out after they take the catheter off." Now, a key to this is you have to be able to laugh at all these things, because if you don't, you just cry at all these things.
Besides what you just said, is there anything else that you wish you had known beforehand? Is there advice that you would give to someone in your shoes?
I wish I had known the truth about percentages. I wish I was more mentally prepared for the likelihood of ED. Not the chance of ED, but the likelihood of ED. I'm not sure I would have ended up in a different place. I think my ability to accept it and to get over, there were parts at the beginning when you first end up with ED that you do think you're less of a man. Sorry, that's a bizarre thing to say, but you do. And you feel like you've forced your wife to give up a part of your relationship. And I remember being, and I told my wife this, I remember being angry at her for every time she had said, "Not tonight," in the course of our marriage prior to that. I remember telling her how angry I was at all those wasted opportunities. Well, if I had been better prepared, maybe I wouldn't have been angry. If I had been better prepared for the likelihood and the possibility, maybe I would have been investigating alternatives sooner. I think I probably ended up in the same place eventually, but I wasn't ready. I wasn't prepared. I was prepared for prostate cancer. I was not surprised by prostate cancer. I was not thrown into a tailspin over prostate cancer. I was not prepared for ED. And you know something? It's a psychological preparation. It's not a physical preparation, because it doesn't define who you are. And vis-a-vis just having implant surgery, there are things you can do. There are steps you can take. So it's not a lost cause. But that was the surprise for me. That was the depression factor. That was the point that I felt I was not given adequate information. I was not given timely information. I'll never forget it, and it's a different procedure. I had a knee replacement about 15 years ago.
Okay.
And the orthopedic surgeon said to me, I asked him if I needed two, and he says, no, you don't. He said, when we think there's a chance that you might need a second one, we convince you to do two at the same time, because the statistics on getting you back here again after you've done one are very low. That's such bull. They're going to make me go through that because the statistics say I may not come back because it's so painful. Who are they to play God and not be sensitive to the humanity of the people they're dealing with? So I kind of, as I started with, I respect, admire, and need medical professionals. Sometimes their decisions to be smarter than their patients are wrong and hurtful.
You mentioned Urology Care Foundation. You are a board member of the Urology Care Foundation. Why was it so important for you to get involved with this work?
In articulating with some of my medical professional friends who, in several cases, were urologists, some of the things I said here today, such as good as new being baloney, and not being as truthful with their patients as they need to be, and the men don't talk thesis. Some of them said to me, here's your chance to do something about it, not just talk about it. You want to do something about it? Join the board. Voice your opinion. Let us hear your side. We have 2 lay members, new. I am one of the 2. Let them hear how a patient feels and how a patient thinks and how a patient sees things. And also, you're a more reliable source to give a message about healing and recovery than we are. We watch it clinically. You live through it. Mm-hmm. And I said, okay, I'll try it. And so far, I've really enjoyed it. I have to admit, though, that the shock of all shocks, I didn't get to go to the
AUA annual meeting.
Yeah, I didn't get to go this year because I was supposed to be in surgery, but I did go last year in San Francisco, mm-hmm. and I didn't realize the tremendous sense of humor that urologists have. Yeah. They are the funniest practitioners in the entire medical profession.
It's important to keep your sense of humor.
Oh, yeah.
Yeah, I mean, it's so important.
When we walked into Moscone, and I don't know if you were there or not, there was a huge billboard mm-hmm. for a surgeon who...
Moscone Convention Center, San Francisco, California. Yes. This is last year's American Urological Association
2018
annual meeting.
There was a huge poster board by a surgeon, a urological surgeon who had just written his memoirs. Okay. And the title was Erecting Giants, yes, a medical memoir.
Yeah.
I thought it was a joke when I saw it. And I turned to a friend and they said, no, not a joke. That's really the title.
Yeah, it's important that's totally accurate. I remember seeing that exactly.
So I didn't realize how humorous they all were.
Please summarize your number one takeaway for patients listening. What is your number one message in a bite-sized form? What can they take away from this podcast that you want to leave them with? Go ahead.
Loved ones, be supportive and give your loved ones who are patients room to think and to feel, and be there when they need support in parsing through what's going on. Patients, please be self-advocates. Please don't take an answer as the only answer. Research, look up, talk to people. I wish I could talk to each one of you as a fellow patient and person who's made it through to the other side. But if you could find a good friend, and men who talk, if you could find a good friend who's been this road and who's willing to talk to you honestly about it, you don't feel alone. You don't feel different. You don't, the statistics are that if every man lives old enough, they're going to have prostate cancer. So there's no reason to feel like, woe is me, I'm the only one. And treatment and diagnosis are getting better and better and better. And now it's 9 years past mine. If I presented today the way I presented 9 years ago, it's not even for sure they would have done a prostatectomy on me because of the advances in watch and wait. So do your research, talk to people, find somebody you know and trust who's been down that road. Don't be afraid to talk about your fears. Don't let ED be a word that drives you into shame and panic. There's nothing to be ashamed of. It doesn't change you in any way, shape, or form. Let your loved ones know how you feel. Don't try to be the man of iron We're not men of iron. We're vulnerable. We're human. And displaying that humanity does not diminish you in any way, shape, or form. Now, if I can just get over my shyness, it'll be a good podcast.
You've been listening to Jay Baylor. He is a board member of the Urology Care Foundation, a prostate cancer survivor, and one heck of an advocate for men. And I couldn't thank him enough for being on and being so open and sharing his story with us. This was pretty cool.
Thanks, Casey.
This podcast has been brought to you by the Urology Care Foundation, the official foundation of the American Urological Association.